asked my husband that I want to go to a VCT and he refused. He told me I should not go. I went and I was shocked to know my status, HIV positive.
I started by disclosing my status to my pastor, my youth pastor, who listened to me and he did not believe.
In our church, Seventh-day Adventists, we've been assuming that our members don't live with HIV and AIDS. We were wrong.
When we started our ministry, we found some grandmothers that they were HIV positive. And we say, how can this be?
We cannot pretend that this virus is not with us.
That HIV and AIDS can affect just about anyone, in church or not, is uncontested. To that effect, how we deal with those infected or affected by the condition will determine how fast HIV and AIDS can be managed and even prevented. Since the beginning of the HIV epidemic, stigma has been a major barrier to its prevention and care. Unfortunately, in churches today, stigma is still a major issue. This has caused terrible emotional and physical damages to those infected with the virus, as they feel unsupported by what was likely their most significant social network.
Tulitaka kuhimiza viongozi wetu wa kanisa, haswa hii yetu ya SDA, wajue kwamba HIV iko kabisa kati yetu, sababu stigma iko katika hali ya juu kwa makanisa. Tunategwa kwa makanisa. Ukijulikana uko HIV positive na ulikuwa kiongozi, unaanza kutegwa. Hiyo ndio tunataka viongozi wajue ni kweli iko na tutasaidiane kuifight.
Stigma still is a big issue. Discrimination continues in practice all over the place, at work, in terms of providing services, and just living. And one of the things that we're trying to do is to ensure that people do not feel alone. We're a gregarious creation, so to speak. We need others.
There are days I know when you get so discouraged, it seems like all hope is gone. But there's one, only one, who can give you courage and strength to carry on. Never give up, Jesus.
Many of those living with HIV and AIDS face discrimination and a less than caring attitude whenever they turn to their churches for help. Even though education and awareness of HIV has risen dramatically since the beginning of the epidemic, surveys show that the general public still has less empathy for individuals living with the virus. For this reason, many HIV-positive people are too embarrassed and would rather suffer in silence.
I would like to see change, cultural change, spiritual change, people to look at HIV not as an immoral disease. It's a disease which is affecting mankind, just like diabetes, just like any other disease. They should not stigmatize HIV and look at HIV like it is for those people who just went immoral and just had sex with almost everybody. No, sex is it's God-given and it should be respected. So if you start stigmatizing HIV, I think it does not please God.
We have very, very sure ways of getting this virus into our church. We are a very evangelistic church, and we go out there, preach, call people to Christ. We never ask them whether they were HIV before we allowed them into our fellowship. So that's a clear way that we have the virus with us. Then there, as I said again, there are those that of our members who are in the church, faithful, especially ladies. Their husbands are out there. That's another way the virus is coming to us. We cannot pretend that this virus is not with us.
But there are those who, despite the opposition, have publicly declared their status with the aim of not only seeking assistance, but also helping others with the same challenges theirs.
I didn't find it hard to disclose my status. I was so eager to tell everyone. If anything, the worst they could do, I was worried about was that they would run away from me. But I started on the right track. I started by disclosing my status to my pastor, my youth pastor, who listened to me and he did not believe. With great disbelief, he thought, okay, this is too heavy for him, and he said he's going to talk to the senior pastor about my case. And they arranged for me, and I met the senior pastor. And I sat down with this man of God. He listened, and he looked at me. They looked at each other, all the pastors, and they thought, if what he's saying is true, then this young man is very bold. But I asked them for an opportunity to be able to reach out to the other youths in our church, because I was imagining if I've been serving in choir everywhere and they didn't know anything, how many of us were in church like that?
After delivering my last baby, I felt weak and tired. I just said there must be something wrong with my body. I asked my husband that I want to go to a VCT, and he refused. He told me I should not go. I went, and I was shocked to know my status, HIV positive. That's what marked the turning point in my life. It was very traumatizing. I cried. I did not believe. I slept for 3 nights waiting to die, but I didn't die. I kept pinching myself, thinking I was gone. Kumba, I was not dead. With the support of other groups like Women Fighting HIV/AIDS in Kenya, I got support, psychosocial support. I got motivated, and then I said back in my hospital, I'm not alone.
Traditionally, support groups have been recognized for their value in providing emotional support to individuals. For those living with the HIV virus, support groups have made it possible for them to meet others who are experiencing similar challenges. Not only that, they are able to obtain useful information and develop different ways of dealing with the demands of the virus.
The purpose of the support groups is to help strengthen people's individuals' will, even just to continue living.
This group of members can lead in a way that the other members in the church will contribute, and they can go and visit, they can give food and cloth parcels, they can pray with the sick, they can help in the rehabilitation. We have a wonderful message of health in the Seventh-day Adventist Church.
Now, the support groups are not only made up of members of people who are infected, but those who are affected as well, and those who are friends of, especially the people who are infected and would like to see some positive elements in their lives.
It is important to be able to find people with whom you can be able to share, whom you can be able to connect with, and whom you can be able to shore up your own hope to ensure that you live a more meaningful life. It helps to share experiences. Others have gone through things which perhaps you may not have gone through. They may be going through the same kind of thing. They share how they manage to work their way through those things, and it helps.
Kingero village in Kenya is one of the many places in Africa that the Adventist AIDS International Ministry has helped set up HIV/AIDS support groups, which have been on the forefront in providing care and support to the locals infected and affected by HIV.
My name is Virginia Waboy. I am a caregiver. I make milking salt. I go house to house where there are animals, cattle. I sell.
Grandmothers in Africa, they are powerful. When we started our ministry, we found some grandmothers that they were HIV positive. And we say, how can this be? 78 years old. And then we realized that nobody thought about educating the grandmothers because they thought they were not at risk. But these ladies, they were taking care of the daughter or the son that they were HIV positive without protection, without gloves or anything, and they were getting infected. That was the first, red light to our attention. And so we talked to them, and in many countries we have these grandmothers support groups, but to make them nicer, we call them clubs. And believe me, they are powerful because these ladies, they have no time to lose, so they get involved, they get on board, and they make wonderful things.
Let me tell you that when we talk about HIV and AIDS, it's not only HIV and AIDS. It's not the virus that we need to chase out. We need to chase out poverty, illiteracy, lack of skills, lack of opportunities, gender inequality, violence, so many things. Those are the things that lead to HIV and AIDS.
Ending stigma demands strong, sensitive, truthful, and well-informed leadership. It demands that the church does more than admitting to the presence of HIV and AIDS in its midst, and that it goes out of its way to nurture and encourage those affected by HIV. Life, hope, and truth, these and not stigmatization and exclusion, are the foundational values of the healing community that the church is expected to be.
Since I came to know about HIV and AIDS, I have been praying, and my prayer is that one day, one person will be tested for HIV, another one for malaria, and they'll be given equal treatment. This stigma that we have 30 years later, we are still stigmatizing ourselves. It's unfortunate that we are not actually following Jesus' example.
We believe that the solution for the youth to this HIV and AIDS problem is Jesus Christ. So today, young people, they need a role model. So we offer Jesus as the role model. When they have Jesus in their heart, they can talk about values and principles because of him. And then with those values and principles, they can develop a Christian character. And when they have a Christian character, only then they can listen about abstinence.
Tackling HIV and AIDS in Africa is a long-term task that requires sustained effort and planning from all stakeholders, the church included. More, though, needs to be done in preventing new infections.
It has been said that if the government or somebody would first of all address the issue of drugs and alcohol, that would help curb many other terrible ills, including HIV and AIDS. So my role in all of this HIV AIDS prevention really is in teaching children and helping them to realise the dangers and committing themselves to Jesus and saying, no, I will not touch those poisons.
My burden is that much as we say that the infection rate has come down, even if we were to talk about 1% or 2%, we are talking about people that are not living their optimum health. And so we look forward to a time when we'll be talking about an HIV-free society, when we won't have any more infections. But for those who are already infected, we can still try and live positively because there is a lot of support for people who are already infected.
Never give up, Jesus is coming. 'Tis the darkest just before dawn. Never give up, Jesus is coming. Never give up, keep holding.